This meeting is being recorded.
All right, good evening, everyone, and thank you for joining us for tonight's town hall on monkeypox, MPX, or Mpox. We're going to start with a brief introduction from our Spanish language interpreter, Giovanna. Giovanna, go ahead.
Buenas noches a todos, me llamo Giovanna Wormsbecker y voy a ser su intérprete en español durante esta reunión. Esta reunión contará con interpretación simultánea bidireccional de inglés al español. Por favor, espere hasta que termine todas las instrucciones antes de seleccionar el globo de instrucciones. Si por favor usted no es bilingüe, tendrá que elegir su idioma para escuchar la interpretación. Si está utilizando una computadora, verá un icono en la parte inferior de su pantalla a la derecha en forma de globo que dice interpretación. Haga clic ahí y seleccione español. Si está utilizando un iPad o teléfono, localice el menú de 3 puntos que aparece arriba a la derecha, haga clic en interpretación de idiomas y luego elija español. Por favor, cuando hable a un paso moderado, ya que la intérprete estará interpretando simultáneamente al otro idioma. Gracias. Thank you.
Thank you, Giovanna. And thank you everyone for joining us tonight. My name is Nick Morey. I'm with Sacramento County Public Health and I'll be your host. My colleague Kyle Lafferty is behind the scenes, keeping everything moving. I'm going to introduce our panelists in just a moment, but first I wanted to go through a few housekeeping items. First, you may have noticed that I use the terms monkeypox, MPX, and Mpox in the introduction. The World Health Organization has announced intentions to officially rename monkeypox. But while we await official decisions, here in California, we've shifted to MPX, which is sometimes pronounced Mpox. But as everyone gets used to that, you may still hear folks use those terms interchangeably. After I introduce each of our panelists, they'll have an opportunity to give you some brief opening remarks. We'll then open it up to answer your questions. You can submit questions using the Q&A function on Zoom. I will then pose those questions to our panelists. Please note that I may paraphrase or summarize questions or group similar questions by theme, but I'll do my best to maintain the spirit of the questions that we do receive. Tonight's session is being recorded and we'll make that recording available for viewing so those who were not able to join us tonight can benefit. We want this to be a safe space for you to feel comfortable asking your questions. So please note that you do have the option of submitting your questions anonymously if you would like. On that note, bullying, discrimination, or derogatory statements in the Q&A are not welcome, so we thank you for your cooperation with that. So now let me introduce our panelists. We have 3 panelists this evening. Dr. Olivia Casurier is Health Officer with Sacramento County Public Health. Kobe Rodriguez, Acting CEO and Chief Program Officer with Sacramento LGBT Community Center. And Jake Bradley Rowe, Executive Director with Sunburst Projects. Dr. Casurier, would you start us off with some opening remarks?
Thank you. Good evening, and thank you again for joining us. And I'd like to thank Kobe and Jake actually for joining us on the panel as well to be able to answer questions. I think one of the things we have learned through the pandemic and through this monkeypox outbreak is that our collaboration with our community partners is very important. It's key to our being able to provide the services to the community. So I appreciate all the partnerships that we have and that are represented here today. So I'm just going to give a very brief overview of monkeypox and then be able to turn it over to our partners. I'm hoping that a lot of this information will not be new to you, but just in case, monkeypox is a disease that is caused by a virus. And usually it starts with symptoms like fever and muscle ache, but then quickly progresses to a rash, a skin rash, And the skin rash can be very severe and can have severe consequences, especially if it's in sensitive areas. Monkeypox has been around with us since 1956, but most of the cases have been in the continent of Africa. But lately, at the beginning of this year, we were notified about cases that had occurred in Europe, and an outbreak had ensued. And so we started preparing to start monitoring to make sure that if there were any cases that were identified, that we would be able to quickly mobilize and identify any people that were at risk and offer them vaccine, and also offer treatment to those that tested positive. So around May 21st, we were notified by about our first case. And this was an infectious disease doctor who quickly, when he looked at the pictures from a patient, quickly realized that this was very similar to the pictures that we're seeing on the CDC sites, and so notified us. And we were very fortunate that we have a lab that is able to do the testing. And so we were able to get the results very quickly, communicate with the state and with CDC, and start our process for identifying contacts and getting people vaccinated. So we're a long way from that right now. And actually at the height of the new cases that we were getting, I think we got as many as 25 in 1 week. And fortunately, we have started to see a decline in that. In the last couple of weeks, we've had 3 additional cases per week. So the numbers where we stand with the state, actually the US, there are 23,893 cases that have been identified, including 1 confirmed death, 4,753 in California. About 56% of the cases are from LA and San Francisco. In Sacramento County, we have, as of the last update, 133 cases that have been identified. We've seen about 5% hospitalizations. So most people do not need hospitalizations, but there are some people who get a very extensive skin rash, and a number of people also get very severe pain, which requires treatment. When you look at the demographics, most of them are young adult males between the ages of 25 to 45. By race ethnicity, the highest numbers are from the Hispanic and the white population. But when you look at the rate, which is comparing the rate in the population and the rate of cases, African Americans have the highest disparity. And actually all of this information is on our website, and Nick or Kyle will put the link in the website if you're not aware of it, in the chat, if you're not aware of our website, so you can check up these numbers. 95% of the cases are among males, and most of them, about 80%, identify as gay, lesbian, or same gender loving. So in the US, there's been about 549 people that have been treated. The treatment that we have available is called tecovirimat. And we've been very fortunate with the relationship that we have with UC Davis that has been providing the treatment for us. So especially at the beginning, almost everybody that was identified got treatment with tecovirimat. For those that are treated, many of them do have conditions that put them at risk, especially HIV. About 50% of the cases that have required treatment are among people that have HIV. And of course, with the immune compromised condition, they can get very severe disease. Switching to the vaccine, we are also, again, fortunate this time around that with this disease, we have a vaccine that is available. We are using the Genius vaccine, And in Sacramento County, we've received about 6,578 vials. And with the county, we've been able to vaccinate using 1,900 vials. And this is where one of the areas where we are very grateful for the partnerships that we have, because we have redistributed 4,700 of these vials to our partners, especially Pucci's Pharmacy. Many of you may have seen articles about them and the great work that they've been doing in being able to get this vaccine to places that otherwise we wouldn't have had access. So again, appreciate our partnerships. We've had many clinics at both the LGBTQ Center and other centers as well. And so probably that's more that you will hear about. So turn it back to Nick.
Thanks, Dr. Couturier. Kobe, would you like to say a few words?
Sure. Just as a reminder, folks, Kobe Rodriguez, I use he, him, and his for pronouns, and I'm at the Sacramento LGBT Community Center as the acting CEO and Chief Program Officer. And pandemics aren't new to our community, and a lot of trauma around viruses exist within us, a lot of generational trauma. We've lost so many folks and a generation of folks to the inadequate response to HIV in particular. And so I have been very proud of the work that we've done in collaboration with Sacramento County Public Health. Most counties are not having this discussion, right? Most counties are not privileged to have this discussion or have done the work or received the amount of support to make this happen. So I first want to thank Sacramento County Public Health and some of the other organizations that were early on providing these vials to folks. So Golden Rule Services, Sunburst Projects, obviously the LGBT Center has been pivotal, and Pucci's Pharmacy. And unfortunately, they can't be here today, but they have been on the front line of providing this from very early on. And so I wanted to name that. Now, we are privileged to be right in the heart of Sacramento. We've been a space that has existed in some capacity for over 4 decades. And so our response and our responsibility is when things get really tough, whether that be around HIV or that is around COVID-19 pandemic or now MPX, it is our responsibility to open up our doors and ensure that everyone receives the services that they deserve. And so we're very proud to continue that level of partnership. Now, we have a long ways to go. The numbers are certainly going down, but every time in these type of responses, there are communities that are harder to reach because there are less available resources to them. So the center has been proud to offer the vaccine both at our Midtown location, as well as our South Sac location. I think the most recent numbers I looked at, we provided about 1,400 on our location sites. And so we take that as a privilege. We know there's a lot of more work to do. We're very happy that Sacramento County has certainly set the bar high on how response needs to look. Now, that doesn't mean we don't have much more work to do. Most of our community-based organizations don't have the adequate resources to continue this fight for very long. We will do everything that we can in our power, but certainly need federal government and funds, and a lot of organizations have been on that level of advocacy. We've certainly joined in that call to ensure that adequate funds are provided and the resources are provided to make this available. So on behalf of the LGBT Center, again, thank you to the county. Thank you to the early pioneers in doing this work and to the other community-based organizations who've been a part of these efforts to ensure that our community doesn't have to relive the trauma that we've had to in the past.
Thank you, Kobe. And Jake, you're up.
Wonderful. Well, good evening, everyone, and thank you for joining. For those who are here, my name is Jake Bradley Rowe. I go by he, him, his, and I'm the executive director here at Sunburst Projects. Sunburst Projects provides services to those members of the HIV community, as well as free testing and for HIV and STIs in the Arden area. As a leader of my organization, it was really important, especially with the folks that we serve here, that we take part in this. And so I'm proud to say that we started providing a space for the county back on the 5th of July and have continued to support in this effort to make sure everyone has the opportunity. I echo all the words that Colby has said about the work the county has done. I think that when we look around and we see the numbers of other areas in our state, and then we reflect on where we're at, we've done a significant amount of work in making sure that the spread of monkeypox within our community here in Sacramento and surrounding areas has been minimal. And we certainly need to, applaud ourselves and those that have participated. I want to touch on the fact that Sacramento County made a very smart move that they didn't limit the vaccine specifically to members who are residents of our county, and that we have served significant amount of people from the Bay Area, from counties that surround in Northern California and the Central Valley. And we've seen a lot of those folks come through our office here. And I think that was very key, that we showed that we were part of a larger plan to help make sure that everyone in our state that is eligible for the vaccine was able to get that. I'll keep it short and say that I'm here to help support and answer any questions I can. But I really think that as a community, we should be happy in what we've been able to do.
Thank you all. So that leads us now to an opportunity for question and answer. So as I mentioned at the top, at the on your Zoom menu, you should see a Q&A button with a couple of dialog boxes on it. You can click on that and submit questions. And you do have the option of submitting questions anonymously. You can check that box if you choose to do so. I'll then pose those questions to our panelists, and we'll do our best to get them answered for you. So right now the Q&A box is looking pretty empty. So we'll give it a few minutes here for folks to type that. I feel bad, Jake, Kobe. I told you, don't say too much at the beginning. We want to give lots of time for Q&A. So while we're waiting on that, feel free to share more.
Yeah, I think we could talk a little bit about the state's response to support CBOs and health organizations within reimbursement of funding. So many of you may have seen that the governor passed a $41 million allotment to support monkeypox vaccine. The Office of AIDS has received a portion of that. And just this last week, they had a meeting where they came to community-based organizations to get input on what to do with that. Now, I will tell you that the $1.5 million that they've set aside to reimburse all of the CBOs in the state of California is minimal. So if you have an ear at the Office of AIDS and you're on this call, please speak up for all of those of us who have provided general funding from our organization and have put ourselves out there with our staff and our resources to make sure everyone knew where and how they could get reimbursed or get the vaccine, and now we're looking at reimbursement for that. So many small organizations, not just here in Sacramento, but throughout the state, are in the same position that the LGBT Center or myself and here at Sunburst and even Poochie's are. That's a big piece of what's now developing in this process of continuing to provide these services is how is it paid for and where do we get reimbursed from as agencies.
Thank you, Jake. So we have received a couple questions, so this is exciting. We'll a couple of good ones here. We'll get it started with what is the easiest, fastest way to get the vaccine? Anyone want to tackle that?
Just jump in real quick, but the county has done a great job from the very beginning of ensuring that everyone knows where the vaccine is available in terms of community-based organizations and Poochie's Pharmacy. So I will include that website there, but both the LGBT Center and Sunburst projects have been pretty consistent on our Monday and Wednesday vaccine availability. We've offered both walk-in and appointment-based ones. And so the next ones that are coming up, the center has one next Monday on the 26th, I believe Sunburst Project on Wednesday, the 28th. And again, you can do both walk up and or make an appointment to get the vaccine. Pucci's Pharmacy generally releases appointments, and so you're able to get that from them. You can also consult your medical provider. A number of vaccines have gone out to some of the larger medical providers in Sacramento County.
Thank you, Kobe. Just to reiterate, the website is mpx.saccounty.gov. Go ahead, Dr. Kasiria.
Yeah, I just wanted to add something. I think Jake mentioned that the county made a decision to allow people from other counties to come and get vaccinated in Sacramento County. Yes, that was a deliberate decision that we made, recognizing that our communities are interconnected and that this virus will not stop at borders. And also, especially at the beginning when the supply was very limited, Sacramento County was early on got generous supply because of we were the first county to report a positive case. So at the beginning, we were getting all of the vaccine that we requested. And so we were able to provide that vaccine to our neighbors as well. Of course, with the limits of the guidelines that the state had given us. But over time, we've been advocating to expand that, knowing that there might be some people who may not have been at the highest risk, but nonetheless do have a certain amount of risk. And now that we have a better supply of vaccine, that we should consider including them as well.
I think that is a perfect tie-in to our next question, both about supply and potential risk. So we have a question: is there concern about the supply of the vaccine? I'm at low to medium risk. Should I wait so that people that are at higher risk can get it first?
Well, right now we have a lot of appointments available. So, and actually it's a self-attestation for what your risk is. So you can just, schedule an appointment or walk up to any of the appointments that Kobe has mentioned, and you will get the vaccine.
All right, speaking of supply, my supply of questions has run out. But we'll give it a moment and see if any other pop up. While we are waiting, Jake, Kobe, Dr. Kasiria, anything else you'd like to bring up?
I guess it would also include just going into the actual vaccine process, that it is a two-part. So if you haven't been vaccinated, it will require 2 visits to one of our organizations. It doesn't have to be the same organization. You can get your first shot at Sunburst Projects, and then 28 days later or beyond, you could return to any of the organizations that are providing it and get your second dose of the vaccine to be fully boosted. I think that's important that people know that. Often we hear when they come in, they think it's a one-time, one-way thing, and it actually is 2 pieces to the vaccine. So.
All right, we've got some more questions piling in. Thanks, folks. So a couple of questions. What kind of outreach is being done in unhoused populations? And they also ask what kind of outreach is being done for sex workers?
So I can start. Oh, go ahead. Go ahead, Jake.
I just was going to say, with regards to the unhoused populations, the various community-based organizations, specifically those Ryan White providers that work with the unhoused population that are HIV positive, have worked within our clientele to make sure that they have the opportunity to get transportation to our sites, to get access to the vaccine. Particularly, Sunburst Projects works with Sacramento Street Medicine, and we provided flyers and information to their staff that are out in the encampments in Sacramento throughout the weeks and have provided transportation when needed for folks that are of the unhoused population.
Yes, and just to add on to that, we do have some of our clinicians that work in our clinic that actually also do additional work in among the unhoused. And so they've been actually able to get specimen collection kits from us. And when they come across somebody who may have lesions that appears suspect, that they go ahead and collect those specimens. We also have had individuals show up at emergency departments for testing, and usually we're able to get that testing either done through the hospital, or it can be done at our county public health lab. One thing that we've also done is work with the Department of Human Assistance, because as you know, if somebody is waiting for results or has been diagnosed with a monkeypox, that they have to remain isolated. And so working with DHA, we've been able to offer vouchers to unhouse people who are waiting for results. So far, we have not had a positive case among the unhoused, but definitely that's something that we have a plan in place to be able to manage in terms of being able to find isolation facilities, as well as make sure that they get the appropriate support care that they need. I think part of the challenge that we have, and I think Kobe alluded to this, is that we have not received any additional funding so far to be able to manage the monkeypox outbreak. We've been using the funds that we already have. Fortunately, because we are just coming off of the pandemic, and we had received additional funding from the county, the state, and the federal government. We have, and also have additional staffing. We've been in a better position to actually be able to manage, manage this outbreak. But definitely, if the numbers were to grow, we would have been faced with some difficult situations and had to expand or be able to hire additional staff. As far as outreach to the sex workers, we don't have a lot of ways of reaching out. I know that through Pucci's Pharmacy, they have been doing some outreach, but otherwise, I don't think that we have anybody on staff who's doing specific outreach to that community.
I really appreciate these questions, because it is in the middle of these crises that oftentimes the most marginalized are neglected, and there's not infrastructure due to a lot of issues around redlining and racism, and at all of those intersections as to why we don't have resources in those neighborhoods. More than 50% of the folks that walk through our doors every day are unhoused community members. We have 4 locations, including a shelter, a transitional living program. And so we get all of those folks automatically kind of into our testing operations and our vaccine operations. So that is certainly happening. We run 2 respite programs, both for transitional age youth and for adults 25 and older. And so vaccines have been provided during those times to those populations. There's still a lot of work to be done in this area. Since Dr. Kasiri went into the piece around sex workers, I want to address that as well. I think there's a lot to do in this area. There's a lot of intersections of sex work and the LGBTQ plus community. So certainly we are reaching those who are near us, but though this is a population that sometimes takes a lot more trust to serve. We have been able to provide vaccines in our Marsha P. Johnson Center South location just adjacent to that location, which is a area that has a higher number of sex workers than our location here in Midtown. That's on Macton, Stockton Boulevard area. So we've been able to offer it there, but it's still a gap. It's still an area where we need to do mobile outreach. And I know Pucci's Pharmacy has been able to do some of that.
There is a couple of questions in here I guess I can address specifically around transportation assistance for people seeking vaccine. I can only speak to the population we serve as a Ryan White provider. The federal government HRSA regulations has opened up to allow us to provide funding that we receive from the federal government to support the HIV positive community with transportation. So as anyone who are clients of any Ryan White agency, those fundings can be used to transport clients to seek the vaccine. I do not personally know of any other funds at this time that are available towards that. There's a question about, oh, go ahead.
I was just going to add for the transportation, actually, the Department of Transportation was offering free rides to people who are going to attend the vaccination clinics. I don't know if it's still going on. We would have to check, but definitely at the height when we were doing a lot of vaccination clinics, they were offering free rides.
I know we had some questions earlier about outreach to specific populations, and there's another one in the chat about efforts to ensure disproportionately affected populations, including Black, African American, and Hispanic populations, are getting vaccinated.
I can start. I did mention at the beginning that we are seeing disparities. When you look at the numbers of cases, the highest have been among the white and the Hispanic population. But then when you look at case rates, which takes into consideration the number in the population, African Americans have a disproportionately higher rate. I think we still have a lot of work to do in that area in being able to provide services to disadvantaged communities. I think some of the challenges that we're aware of, and there are probably more with the African American community, is what we're hearing is that oftentimes they will not identify as gay or lesbian. Basically, they're still in the closet, although they might be engaging in certain behavior that put them at risk. And I think part of the challenge there is that the criteria that the guidance that we have for who can be vaccinated does include language about MSM and gay and lesbian. So if somebody does not want to identify themselves as such, even though the behavior that they engage in puts them at risk, they may not come forward to get vaccinated. We've had people who've told us that they did not want, they were hesitant to give us their name because they didn't want that information to go either to family members or to the insurance company, or sometimes they're concerned that the information might get to their workplace. Unfortunately, we're still dealing with stigma in this country. And so people might forego getting the vaccine simply because, they're afraid of, the information, unfortunately, getting out to people that might not approve. One thing that I'll say about that is that the information that we get is confidential, and we treat it just the same way we would for a medical record. And I think we've been able to allay the fears of people who've had those kinds of concerns. But there still might be some out there that have not come forward. And so that does make it difficult. I think one of the other strategies that Puchis has used that has probably helped is being able to go and offer vaccines at some of the private parties that occur in homes. As a county, we don't get to know about those. And also at some of our venues where they've been hesitant to have county people, but we're willing to have staff from Puchis Pharmacy. So again, we are very dependent on our partners in the community that are able to reach out to communities that would otherwise be hesitant to come to services that are provided by the county.
I would also add, specific to the disproportionately affected populations, I think the county did a really good job in the very beginning when they started marketing the issue of monkeypox rising in our communities, using images that were appropriately and reflected all communities. I know I said on a couple meetings where there was discussion around how do we best connect to the communities that were being affected by this? How do we make everyone understand that it could be anyone that could be affected by this when we were reaching out to them. So I thought that was a really important piece of the marketing that happened in the very beginning. We've seen a good cross culture piece to the vaccine clinics because of it.
Well, just a couple other pieces for us. Again, want to reiterate, there is not a funding opportunity at the moment that is making these initiatives easier to get out to folks or get the vaccine out to folks. We still chose to use our marketing dollars to really target neighborhoods in the community that are vastly majority Black and Latinx communities. So we made a conscious effort to ensure that folks had at least the information. We certainly do provide transportation assistance to all of our clients, depending on what no matter what the need is in the organization. And so we've done that, particularly South Sac neighborhoods. We've done North Sacramento neighborhoods, Rio Linda neighborhoods as part of our marketing efforts to really target Black, Latinx, and AAPI communities. Additionally, we have those same staff in our sexual health unit. I think that's an important part of what Sacramento County did that was a lot different than many other counties, which was to house some of these efforts in their sexual health unit because we understand the level of stigma that exists. The staff all understand that stigma, and the staff are able to serve the community in ways that feel a lot better and might be familiar faces. I like to think that I know a large number of our LGBTQ population. And when I saw those lines at our center, there were so many people I hadn't seen before, which both reiterates, I think, 2 points. One, that we are serving folks that are sometimes outside of our community. That was certainly not a majority or a vast majority. The way sometimes the news headlines want to spin things, the vast majority were Sacramento County residents. And it tells me that there are a number of folks who are not out, who are not open about their sexuality and still felt a level of comfort in seeing that they got vaccinated at any one of our centers, but I certainly want to speak for the LGBT center. Oh, and if I can have one more piece, because this comes back to all of our data. You have to count us, right? So a lot of people don't count LGBT identities. A lot of people don't count at the intersections of race and ethnicity. And so it is really important that we include that in all of our intake forms so that we understand who we're serving and most importantly, who we're not serving.
I'm wondering if Kyle had something that she would like to add since she actually oversees some of the efforts and the outreach.
Sure, I can chime in. I want to thank you, Jake. You mentioned the media campaign, and I really appreciated all the input from all of our partners in creating some really comprehensive and inclusive media images that we were able to put out. And then just again, to echo all the great work of all of our partners, because it was those relationships that helped us to be able to offer vaccines and to really prioritize folks who might not have otherwise been able to access the vaccine and those resources. So yeah, just echo what everybody else has said.
Great, thank you everyone on that. So Dr. Kasiria, you opened with some remarks that included some of the data and the trends that we've been seeing in terms of number of new cases, et cetera. A question came in, is there a possibility that not all cases are reported to public health?
If a specimen is collected and tested in a lab, the lab is required by law to report all positives to Sacramento County. Healthcare providers are also required by law, this is in the Health and Safety Code, to report any positives to Sacramento County. I think, or actually to any of the counties, depending on where the person resides. I think if a person did not seek care, did not get tested, there is a possibility that there might be some that we're missing. But definitely if there was a positive test, that test is reported to public health.
Great, thank you. And then we have a question about vaccine efficacy. It says, how do you respond to community members that read from the CDC website that there is no data on the efficacy of the vaccine with the current outbreak?
Thank you for bringing that up. I think sometimes the information that you find on websites can be difficult to interpret. What the CDC is saying when they make statements like that is that this is all new to us. The Genius vaccine was approved in 2019 for vaccination against smallpox. But because monkeypox and smallpox belong to the same virus family, there's a lot of similarity between them. So the vaccine also works for monkeypox. They're of course still doing studies with all of the information that we're submitting in order to find out the efficacy. But we do know that it has been at least from the limited data that we have, that it does offer protection. Actually, it's the best tool that we have to offer preventative protection for people that might get exposed. Probably in a couple of months, they will tell us more about what the efficacy numbers are, but that should not deter you if you are in one of the communities, or if you engage in activity that puts you at risk, you should go ahead and get vaccinated. I think there was a question also about if a person got vaccinated for smallpox, because there was an older vaccine called ACAM 2000 that was used before. And if you recall, some years back, beginning of in the early 2000s, there was a campaign to get people vaccinated, especially those that worked in the armed forces. What we know is that for people who were vaccinated before, they might get some additional protection from previous vaccination with the ACAM 2000. But what we have advised for people who have, especially those that have been identified as being exposed, is we still go ahead and vaccinate them, especially if the vaccine was more than a decade ago. We have been vaccinating them.
All right.
On the prior question, if I might add, I mean, really the reality is that we often work from a harm reduction standpoint. And so some folks are going to choose not to be vaccinated, or they're going to have a lot of hesitancy in getting vaccinated. And so our staff members really lean into having that discussion of what makes a person hesitant. And if that is based on misinformation, then that opens up the opportunity to address that. Here's what science tells us. Here are the trends. there is a correlation now with the higher level of vaccination with the lower or a decrease in folks getting MPX. And so I think having those discussions, some folks are scared because of the history around vaccinations in the US. That fear is valid, and it is our responsibility to validate that fear and allow folks to make that decision for themselves. And so we can work from a harm reduction standpoint of here are some areas that maybe if you reduce these activities that you may lessen that harm if you choose not to be vaccinated, or even if you choose to be vaccinated. And so some of the stuff that some of the marketing that the county put out really addresses that. Maybe you want to consider how many folks that you are having close sexual contact with. Maybe you want to limit how many people are in your pod and that you're in close touch with, how many people you might dance with, skin-to-skin contact inside an enclosed area. And so I think it's providing that information, still empowering folks to make that decision, but not shaming people into getting vaccinated. That never works for any population. And so I think having those honest and true conversations allow people to make a conscious decision, because either way, at that point, they are making a conscious decision. Not having any information isn't really making a conscious decision. And so I think when people are empowered with that information, then they can choose to be active participants in getting vaccinated or choose not to, and maybe change their behavior.
Yeah, thank you for bringing that up. And I also actually wanted to just give talk about the experience that we have had in Sacramento County. After we received notification of the first case, we did what we call contact tracing, where we interview the person, find out all of their contacts that could have been exposed, and get them vaccinated. That is an old method that we use in public health, works for communicable diseases. And so we did that, and what we've and actually, if you go on our website and look at the numbers, after our first initial 5 or so cases, because of the work we had been doing with the contact tracing and the vaccination, we went for about a period of about 3 weeks with no additional cases. I'm pretty sure that if we had not been able to identify the individuals and get them vaccinated, that we would have seen more than just those initial 5 cases. Of course, unfortunately, because there was ongoing spread from other exposures, people traveling to other parts of the US, or people traveling to Europe and getting exposed, we started getting additional cases. But from that initial exposure, because of the work we did and because of the availability of the vaccinations, we were able to stop the spread from that initial case.
Well, and I would say that to add to that was the importance that the county really got on to the public outreach piece immediately. People started talking about monkeypox, whether we agreed with what the media was saying or not. All of our local media came forth and started bringing awareness around it, that it was here and that it was happening. And I think that was key, because then people started asking questions. And as soon as we were able to provide vaccine in the various settings that we had, we immediately had a major influx of folks wanting to receive the vaccine. So really important. And then the other piece of that was, the response that we saw.
Thank you all. Kobe, you mentioned a harm reduction approach a moment ago, and we just got a question in asking if there's training available for staff working in harm reduction or direct services.
It might be a system question more than the LGBT Center perspective, so I might defer that to the county.
And actually, Kyle might have an answer too for that.
Sure. So harm reduction in general, yes, we do have some trainings available, and actually there's some wonderful partner agencies that we work very closely with as well. Harm Reduction Services has some amazing staff And they presented a training for our sexual health promotion unit recently as well. So I'd be happy to put you in touch with them. And if there's any interest in additional trainings or services, you can certainly reach out to us.
My apologies. I interpreted that as like MPX harm reduction services. So my apologies for misunderstanding that. We certainly do training around harm reduction and provide some of those services, but maybe if the anonymous attendee might clarify if that was the route that they were going.
MPX.
So I can say we have risk reduction strategies. So we've created some resources specifically to minimize risk of transmission. And I don't know, Dr. K, if any of our public health nurses or anybody from communicable disease has other guidance available, but for, I know there's on our website, we have some resources available for reducing risk, isolation guidance, things like that. And I know CDC has come out with some specific guidance as well for certain settings to reduce risk and what to do in case of an outbreak. So congregate care settings, things like that.
Yeah, I think that brings up a really good question. I know that with our public health nurses, of course, because the cases that come to their attention, these are usually people that have either been exposed or are exhibiting symptoms. They do give some education on risk reduction, but it's just basically to say, okay, you're going to be in isolation. These are the things you need to do. You know, you need to abstain from any sexual contact for this period of time and so on and so forth. But I think that there's also room right now, especially now that we're seeing a reduction in the number of cases, to think and develop more information that we can provide to individuals about some of the risks. I know that is done a bit when people are getting counseling for PrEP, which is pre-exposure for HIV. And I think those opportunities to address any other risk factors that put people at risk for monkeypox as well. So I think there are more opportunities that we can look at.
The County of Sacramento on their website has a great flyer, and it's on the main page, monkeypox page, and it's reduce your risk, and it talks a little bit about opportunities for risk reduction, repurpose your pod, consider putting things on pause, so limit your sexual activity with folks outside your pod, open communication, condoms are important, and then care for your community, think about what's best for the whole. So I thought that was a great item that came out early on, and if you're looking for something specifically that you can use within your group or friends, family, organization, check out the county's monkeypox website for that particular flyer.
Thank you for bringing that up.
All right, well, I think we are almost up on time here, and it looks like we've exhausted the Q&A box. So I think this is a good time to open it back up to our panelists. If anyone would like to take a moment or two and make a final closing remark, we'll start to wrap it up here. So I'll open the floor up.
Well, sure, I can start here. I guess the most important thing I think right now is that we continue to talk about mpox, monkeypox, that we continue to communicate within those folks that we know may be possibly part of that opportunity for vaccine, that they meet the criteria, that we talk to them and let them know the opportunities that are out there. just like HIV or STIs, having open communication is so important to reducing the stigma around it, to making sure that it remains relative, and that the work that we're doing as a community continues forward. So just having opportunities like this town hall where our community can come and learn more and we can talk about what's going on is a way to communicate and keep those lines open. So appreciate everyone who's shown up tonight, asked the questions, and allowed us to share a little bit more about the efforts.
I will share that in all of these pandemics that we've dealt with over the last 2 years, it would behoove any of us to not make changes and adjustments to our strategies as a result of the lessons that we learn, both with COVID-19 and with MPX. We're seeing science work right in front of us, right? We're seeing the ways in which, and while a lot of this stuff was in the works for a long time, we're still seeing some of that science in front of us. And there are lessons that need to be learned. Sometimes when we get out vaccines, it is given out to the folks that are, naturally, it's given out to the folks that are easiest to reach. And I always think we need to start with the hardest to reach, because that's when you might have some of the more availability. How do we get to the hardest to reach? And so I think understanding those lessons. Additionally, in this, we need to understand that the fluidity of gender. And so in just about every county in the United States, it is using language like men who have sex with men. And while many of us use that language, we have to understand there's a lot of fluidity to gender. There are more and more folks, particularly our younger folks, that are identifying as non-binary. These are adjustments we need to make so that we're not having to catch up later, that we just make those adjustments from the onset. So really widening, we have certainly as the center been an advocate for widening the criteria. We know why the criteria is done in the way that it's done. We certainly though see people every single day who say, hey, I don't fit into the category, but I'm also not the opposite of what the county thinks I am or what the state or the country thinks I am, right? So they may say I'm not a woman, may not identify as a man. So I applaud the county for having opened up that criteria. I hope this will be a model for other counties to open up that criteria and focus more on the action and less about the identity. So what is their engagement that's putting them at risk, less so of what is the anatomy of that person or what's the gender of that person. And so I think these are lessons that we are learning, and I hope that we'll continue to learn. But our community, LGBT community, became a highly COVID-19 vaccinated community. I think that positioned us well in MPX. As soon as there was an alert, as soon as there was an urgency, our community responded to that. There's still a lot of communities to be reached. We have not provided the vaccine in all the languages, threshold languages that I think we should. So these are lessons moving forward. We are in a much better position today because of the work that has been done in relation or in between the county and its providers. There's still more work to do, but it makes me feel a little bit more relieved to wake up in Sacramento County.
And again, I want to thank our partners, because there's no way we could have done all of this without the collaboration that we have. I think my parting words are more of the emphasis and realization about the need to have trauma-informed clinical services, a place where people feel safe to be able to come and not feel that they're going to be judged. I remember some of the individuals that have come through our county clinic where some of them were very hesitant to come forward and even get tested, where some of them, when they were initially contacted, they were like, I want nothing to do with this, don't call me. But then because of the realization that we were there not to judge them, but to make sure that they were okay and that they got the appropriate care. And then, you know, hearing some of them afterwards saying, oh, thank you so much for the way I've been treated here. And, you know, knowing that when they spoke that we were listening to them and that, you know, we're giving them the best care possible. Because one of the things also that I found out is that even for people who have insurance coverage, sometimes they have had a difficult time being able to get appointments in clinics in a timely fashion, or sometimes, you know, they get tested and, you know, they get sent home and, you know, they have to wait a very long time to be able to get results. So it's really important. I think there's a key role that we play in being able to provide services with no barriers and services where people feel safe. And so my hope is that through this crisis that we have had to deal with, that there will be more trust between us and the communities that we're trying to serve, and so that we can continue this partnership, because ultimately what we want to do is make sure that all of our residents in Sacramento County are healthy and safe.
All right. Thank you all. With that, I would like to end by thanking our interpreter, Giovanna, our panelists, Dr. Kasirier, Kobe, Jake, and Kyle behind the curtain. And thanks for stepping up as an unofficial panelist a few times for us. Thanks to everyone for submitting your questions tonight and participating. If you didn't get a chance to ask your question, or if you think of something later, you can visit our website at npx.saccounty.gov or email us at npx@saccounty.net. Good night, everyone.